this meeting of the Westwood Board of Health to order. With permission of the board, Westwood Media Center is recording this meeting. Is there anyone else present who would like to record the meeting, or is there a member of the press present? I hear no response. I'll assume there is none. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, Mass General Laws, Chapter 30, Capital A, Section 18, and the Governor's March 23, 2020 emergency order imposing strict limitations on the number of people who may gather in one place, the Board of Health meeting is being conducted via remote participation by the board. The meeting is available live stream through the Westwood Media Center, and the public can view the meeting by accessing a link that's posted on the Westwood Board of Health website. Our government channels will be broadcasting the meeting on Comcast Channel 12 and Verizon Channel 42. The public is encouraged to watch our meeting via the Westwood Media Center live stream. At the end of the meeting, the public will be allowed to make comments if they wish to do so, and also during portions of the meeting designated for public comment by using the conference call in the numbers listed on the website. And I will continue to give guidance and instructions as needed with the help of Connor from the Westwood Media Center. And every effort will be made to ensure that the public can adequately access the proceedings via technological means. So, proceeding to the agenda. Have the three members had a chance to take a look at the minutes of our meeting of April 21, 2020?
Roger Christian has.
Okay, and do we still have Carol?
Yeah, I'm right here. Yep. Yes, I read the meetings and
Okay.
I approved them. Did you hear me, Jim?
Okay. Roger, do you have any changes to the
I have
minutes?
no change. I move they are accepted
Okay.
as they have written.
We have a motion to accept the minutes as prepared. Do we have a second?
Second from
Carol,
Carol.
would you care to? Okay. I'm going to call a roll of the members. Carol Ahern, how vote you on the motion?
In favor.
And Roger Christian, how do you vote?
In favor?
And I will vote in favor as well. So the motion passes unanimously. Next, we have on the agenda the appointment of the annual animal inspectors. Jared, do you want to take over from here?
Sure. So we were asking the board to vote to appoint the following individuals as inspector of animals for the upcoming term. So that would be Dr. Carolyn Thorne, DVM, Officer Paul Joliker, Jason Roberts, animal inspector, and Laura Fisk as the barn inspector.
Okay, so there's a motion before the board that we approve those four appointments. Is there a second?
Second?
Okay. Carol Ahern, how do you vote?
In favor
Of all four?
of all four. Yep.
Roger Christian, how do you vote?
I vote in favor of all four as well.
And I will vote in favor of all four also. So those appointments are made unanimously by the Board of Health. Next, we have the appointment of the burial agents. Jared?
Okay. So we're asking the board to vote to appoint Dorothy Powers, town clerk, and Teresa Reardon, assistant town clerk, as burial agents for the upcoming term.
Okay, we have a motion before the board. Is there a second?
I second it, Carol Ahern.
I'll take a roll of the members. Carol, how do you vote on the motion?
In favor of all
Of
two.
both. And Roger Christian?
I vote in favor of the burial agents.
And I will vote in favor of both as well. And so that motion carries unanimously by the Board of Health. The next item is an item that I put on the agenda in my capacity as moderator of the town of Westwood. I submitted to Jared a list of 7 questions, one of which has a number of sub-questions. In my capacity, seeking advice of public health and safety officials of the town of Westwood, given that the governor has declared a state of emergency, the select board has declared a state of emergency in the town of Westwood, and we have as well. I want to state for the record that because I am serving in a dual role on this issue, I have sought an opinion from the State Ethics Commission. And after consulting with them, I was advised that I should submit what is called a Section 23B disclosure statement because of the appearance of a possible conflict of interest. I have submitted that. The opinion of the State Ethics Commission is that I may participate as a member of the Board of Health on this issue, but I ask that the disclosure be made a part of the record of this meeting. Have the members had a chance to take a look at the list of questions and the list of answers prepared by Jared?
Yes, I have, Roger Christian.
Okay, Carol, have you had a chance? Okay.
Yes, I did, Carol Ahern. Yeah.
So I'm asking that both of those be part of this public record as well. So now I'd like to open this up for discussion.
Okay.
You want to start, Jared?
Sure. So what the chair has asked me to opine on has been sort of addressing the COVID-19 pandemic safety when it comes to the upcoming town meeting. So obviously we have some challenges with town meeting upcoming. We have necessary financial articles which need to be heard and voted on before the town that are necessary, that shouldn't be held until the next fiscal year. So we're trying to determine the best, most safe avenues and what precautions we can put in place to assure the public entering the event to participate, that we've sort of tried our best to cover all of the unnecessary risks that they might encounter by attending the event. So we had a number of things to sort of think about, whether this would be an indoor event, an outdoor event, what the challenges were to both, what the impact on COVID-19 safety would be on both, if we are responsible to have full quorum, or we have or we get an adjunctive relief that would limit the amount necessary for quorum, is a key factor as well. So, you could down the list, the governor's emergency order restricting gatherings does not apply to municipal legislative bodies. So that gives us the ability to hold the event. This is deemed necessary by the moderator in order to work through these articles that have a financial bearing on the town's ability to meet its financial obligations. So we're working under the assumption that this event needs to occur prior to the fiscal year change July 1. So currently it's scheduled to kick off the week after the election. I believe it's July 8th. Let me double check.
June 8th.
June 8th. So, I started to think about how we would handle it if we were going to handle it inside. We had other members of the town government meet last week at the high school to look at the auditorium, to see how we could fit safely using 6 feet social distancing attendees, and what would be space that we would provide for people that weren't wearing masks, or people that needed special accommodations. So we identified 3 possible spaces for sort of ante rooms in addition to the main gymnasium. We worked through trying to count the total number of participants that we could safely fit in the gymnasium. That number came in somewhere around 120. Full quorum is 175. So if we don't get permission to reduce the quorum, we might have to do some satellite rooms or some breakout rooms to be able to fit the required number of people in that space, separating them out into multiple rooms within the high school in order to have the full quorum. Then we would have to have AV, Zoom type thing, so that the full hearing or the full meeting that's going on in the auditorium could be viewed in rooms outside of the main room. So that led us to sort of think about, well, what if we did it outside? Certainly, the initial research would indicate that outdoor events have a lower risk of transmission for COVID-19 than indoor events. So that was a factor that we were trying to think about. Then in that case, it's weather dependent. So, there isn't probably a one size fits all approach at this point. I think the main challenge is to determine whether or not we get this relief on quorum. And I think that would probably go a long way to sort of guide us in whether we would think about outdoors versus indoors. I don't know if you guys have thoughts on that. If you would think it would be more in line to just do it inside based on the number, or to try to figure out if there's a feasible way to do it outside on the fields and accommodate parking and whatnot.
Tell us about relief from quorum.
I have a couple.
So I believe there is, the town attorney is trying to get injunctive relief to reduce the quorum of the members, because we have a full town meeting, not a representative town meeting. In order for the town to conduct business, the quorum number would be 175. So with relief from that number, given the state of emergency, I believe that quorum number would be reduced into the mid 40s. So that would give us the ability to hold a town meeting with less representatives in the crowd, thereby reducing the opportunity for somebody who might be an asymptomatic carrier of COVID-19 from being in attendance.
Thank you. What is going to be coming before the town meeting? Is there any controversial issue? How many articles?
It's my understanding. Yeah, go ahead, Jim, if you.
Yeah, there's two mechanisms to reduce the quorum, Roger. One is town council's complaint for an injunction in the Superior Court, and there was a prior order in April regarding the town of Marblehead, and the court permitted a reduced quorum on an emergency basis, provided the town meeting addressed only items related to the budget. And I think that's what Pat Ahern's complaint requests. The other mechanism where we could get, in that complaint, authorized by the select board, would allow Westwood to reduce the quorum to 44. There's also legislation up at the State House that would allow towns like Westwood with an open town meeting to reduce quorum to 10% of what the current quorum requirement is. Now that is just a minimum, doesn't cap it. We cannot cap town meeting. So whoever shows up has to be allowed to participate. And if the room isn't big enough, if we have too many people, then we're going to have to recess the meeting and reschedule it to a place and time where we can handle everybody who comes.
So in terms of the finances, we're not dealing with the primary schools. What monetary issues might come up that would create a lot of discussion?
Very seldom, at least the last few years, have Westwood citizens had many questions on the budget. Most of them have been on zoning articles and other articles that have come before town meeting. This would be, if we do proceed with a lower quorum, it would just be to pass the town budget, yay or nay. Does that answer your question?
Yes, so that shouldn't result in much controversy, so I should think that would make the meeting rather short.
That's the hope. We don't want to prolong it. We don't want to increase
Right.
the risk exposure.
Okay.
I have a couple more questions, Jared.
Yeah.
Something I've thought about since. One thought was the gym can hold quite a bit. And ideally, if we held it indoors, the gym would be the place to hold it. But there was something I read in that article in the Washington Post about a week ago that indicated that you really need to keep the ventilation running, because that would reduce the risk of. But the problem with the ventilation system in the gym is it's very loud. People complain that they can't hear the speakers when it's running. Can you talk a little bit about that? I know I'm throwing you a curve. I'm not sure if you're ready to address that, but.
I mean, well, generally, I mean, that would kind of come under the question we had talked about is, would we require people to keep their masks on or not during the event, indoor space? I think it would be something we would have to try it out, ahead of time to determine at, what level the noise is going to impact the PA system or the ability of the system to drown out the speakers. That obviously wouldn't serve our purpose. I've never been in the gym during a time when the ventilation system was operating, so I don't know how loud it is in relation to what the speakers amplification would be. So I think it would be a little bit of trial and error. Certainly, air circulation would be more ideal than not. In terms of keeping people, keeping the air moving, and that, even keeping people moving. I think one of the issues I struggled with when we were preparing this exercise was to think about people seated in the same space for longer periods of time than what we have been sort of advising people. Right now we're advising people not to linger. If you're in a store, if you're in an environment, if you're in a line, let's keep moving. Let's not stay in one place. So by then people to sit in a confined space, for a relatively longer period of time, there may be an increased possibility there that sort of that lower level of aerosols could linger a little bit more than if it was more of a moving environment. So that's kind of where I was caught up on that. But I think for purposes of judging the sound, we would have to do a little trial and error. That was even true for, if we decided we would recommend that it was held outside. That would be another issue. How would we use a PA system? Is there a system already capable of being broadcast loudly enough that the participants can understand everything that's being said from the distances that they're going to be asked, to comply with the 6 feet of separation. So if it's overly windy, or stormy on a day where we're holding the event, how that would impact the ability of the participants to hear what's going on.
Well, I can tell you from experience, the HVAC system in the gym is very, very loud, and people are going to complain to me if it's running while people speak. Carol and Roger, I wonder if you share the same opinion.
Yeah, I guess my thoughts, because, we've done it many times in the gym and it can be noisy. There's no doubt about it. I suspect there's going to be less people, and it's going to be a quicker meeting because of the limited warrants. My concerns about being outside are more weather related and the wind, because the sides will have to be up to circulate the air. And, I've been to the night before graduation ceremonies outside under the tent, and it's not that comfortable. And I know Elizabeth was a rainy night, and I thought you couldn't really hear too well. And, if we're talking about a meeting at 7 or 7:30, it's starting to get dark. And I don't know, my feeling is we should kind of go with the gym because we know what it's like, even though the sound system and the noise may be a little bit of a damper, but I think we can socially distance easy enough there. It's large. And, it would be great if we get the quorum reduced, but how many people do you think are really going to come for a short meeting with not any, major articles for discussion? So I guess I'm kind of tending for inside as the safest and easiest and less costly place to have the meeting.
Okay.
We also
Who
have to
knows
think
how
about,
many are gonna come, I think. Go ahead, Roger.
we also have to think about bugs outside in the evening.
Right.
That's fair.
If we did hold it outside, could we spray for mosquitoes and bugs, Jared?
I would have to see. It becomes tricky because it would be on school property, and they have a separate set of regulations that involve any kind of insecticide usage, and there's some hoops we would have to jump through in order to get the mosquito control people to have permission to go onto the school property. That would probably have to go through Ken Aries' office, because every public school is restricted in what types of pesticides it can use and under what circumstances they can be used. So we would have to work with the school department on that.
Also, any insecticide at that time of year would have a negative impact on beneficial bugs as well.
Okay.
That's fair.
So is our responsibility really just to kind of say if it's, safe, with all the types of social distancing, masks, and provisions for people without masks? Is that really what we're discussing?
Yeah, I believe our responsibility is to make recommendations to the moderator on the sort of best practices and what has been documented to be the safest approaches to minimizing the spread of COVID-19, and then presenting those, whether it's social distancing or masks or hand washing or temperature checks or signage or a combination of all of those things. That would be our role to advise of what would be considered best practice.
Do we have to really make a recommendation today? Can we delay it for 2 weeks?
We're hoping to get an answer on the quorum situation, and we're also waiting for some guidance document coming out of some other non-governmental organizations that are going to help to sort of steer this. So I would be content to say what we have right now is a work in progress, and would be subject to revision once we get final word on quorum is going to be required.
So ultimately, the decision about inside, outside, given, what our recommendations are for safety, really it's between the moderator and the select board, isn't it, for the place?
Well, initially, it's the select board's decision.
Okay. So we're just
Well, there's a
making these
couple of things.
recommendations.
Yeah, I'm seeking advice as moderator. But I wouldn't be opposed to the three of us as a board voting to direct Jared as the public health director of the town of Westwood to set some rules regarding public health during the conduct of the meeting. So let Jared tell us whether it's going to be a requirement to test people's temperatures or not. He's indicated that's probably not necessary. He's advising that people be required to wear a mask, that sort of thing. I think I'd be more comfortable if that came from Jared rather than me making those decisions as moderator. How do the
But
two of you
then,
feel about that?
do we then ask Jared to make the final decision about whether it's inside or outside? I don't know that that's fair.
Well, that's not really his decision.
Okay.
I suppose if the select board voted that it had to be indoors and I felt strongly it had to be outdoors, I could recess the meeting, but I don't know if I'm prepared to do that. If the three of us, or the two of you, I'm looking for advice from Jared and the two of you because of medical backgrounds. If the two of you felt strongly that it should be outdoors, then I'd probably take a stronger position. The reason I'm leaning toward outdoors is there was an article in the Washington Post a little over a week ago, and it was written by a biology professor at the University of UMass Dartmouth. And what he did was he studied all the outbreaks of this virus. And he said, of all the countries that conduct contact tracing in the world, there's only been one documented instance where the virus was transmitted at an outdoor event. Every other transmission was as a result of an indoor event. And it seems that, and the numbers are lower, it's not majority, but one of the bigger offenders are religious gatherings. But mostly it's gatherings indoors in an enclosed space. So I asked Jared to look at that. I haven't heard that was bad science, so it seems to be accurate. But that was swaying me in one direction. I don't know if the two of you have seen that.
Is that the Brueggemann article? He also talked about a coral group where 85% of the participants were infected by one member in that coral group in the Seattle area.
Yes, I believe it's the same article.
Right.
It was Dr. Aaron Bromage.
Oh, okay.
Out of Australia, but currently he's on faculty at UMass Dartmouth.
All right. Then it's similar.
Roger, a minute ago, you talked about delaying the meeting. I'm sorry?
I didn't say anything.
A moment ago, you talked about delaying the decision for 2 weeks. Okay. What was your thinking when you said, why don't we put it off for 2 weeks?
Well, to see whether we get this relief from Quorum and whether that would help us any.
Okay. Well, I don't have a problem meeting again between now and then, but I think after this meeting, the select board is meeting on Thursday, and they'll discuss it, and they're going to issue the warrant. So I think they have to vote on the warrant on Thursday. They have to sign it on Tuesday for the town to be ready to vote on June the 8th. I think the warrant is going to say it's going to be held at the high school, so I think there's some flexibility of whether it's held indoors or outdoors. I would say probably of the towns that have open town meeting, probably 95% of them are holding their town meeting outdoors.
Interesting.
And we could do it on the football field. The rec department could grid off the field with chalk the way they do a football game or a soccer game. You probably have to grid it off in lines of 7.5 feet apart. People could bring their own chairs. Carol, you mentioned the outdoor graduation ceremony. That was under a tent, right?
Right. Yeah, this was like the Friday night awards. And this,
Did you hear that?
this goes back like 14 years ago anyways. It wasn't conducive, for the families to be able to, then again, we were sitting side by side and that was under a tent.
Okay.
I guess I think indoors you're going to have less obstacles, like Roger mentioned the bugs, or now we're talking about wind. I just think we know how it can run inside. And if we do the social distancing, people wear masks, they use the hand sanitizer as they come in. I don't know. I'm sorry. I just kind of feel that's the way to go. Otherwise, we're having to create all sorts of systems, to get the system outside, the setup, and then if it does rain, what's the backup plan?
Well, the backup plan would be a rain date the next night. The football field
Okay.
does have the sound system.
Yeah.
Okay, Roger, any final thoughts?
No, I'm at the moment tending to say indoors. As long as people are wearing masks and at social distancing, those droplets drop pretty quickly. And there won't be a lot of moving around to stir things up. And the doors can be kept open.
Yeah.
I think checking the ventilation system would be good as well.
Checking it, or I guess my question is it safe to shut it off during the meeting?
I was thinking more checking for noise.
Oh, it's going to be loud. It always is. And we'd have to spread people out in the gym, so people in the back may have difficulty hearing, depending on where the speakers are. But maybe that can be addressed. So I'm going to make a motion that we, as a board, vote to direct Jared to set some safety rules for the conduct of a town meeting. Anybody care to second that motion?
You want to specify again what you're talking about? Distancing, masks, hand sanitizing.
Right.
No need for temperatures. Right? Is that what you're thinking, Jared?
Yeah, given the emergence of the literature on asymptomatic carriers, what has been more commonly presented in the conversations I've had with other health directors is that everybody self-certify that they don't have a temperature in lieu of checking them at the door. That just creates another sort of another issue for an employee or a volunteer. Would have to be recruited.
Yeah. What about those questions that are asked when, employees go into the hospital, about symptoms?
Right. It's similar in the literature in the questionnaire. Would be, have you been asked by your local board of health to quarantine? Have you had contact with someone who's tested positive? In the last 24 hours, have you had a fever over 100.4 or 100.3? And if any of those questions the answer is yes, then, you cannot enter, or you have to be adjourned to another room. I don't know what the legal issue I don't know if we could bar someone. So I think we probably would have to seat them in an alternate room. I'd have to check with Pat Ahern on that, because that's definitely not my comfort zone.
Jared, would you be thinking about doing that screening for this town meeting?
My thought was we would have signs posted at the entrance, and if it works, that would be deemed a sort of a compliant contract with the participant, saying, by entering these premises, you stipulate that 1, 2, 3, 4, something to that effect. A few of the other health directors around the neighborhood we've sort of all been meeting on this to kind of discuss different ways. Some town, or one town that I've spoken with, has actually had the participants fill out a card. It was either in person or online. They're going to have to fill out a card in advance, and actually, affirm it in writing. So it's sort of, we're sort of still waiting for some legal opinions and some additional guidance to formulate our final sort of regulatory footwork on this. But that's all in the ballpark of what I was thinking and what other directors I've spoken to have talked about.
Can we add to that list? Are you currently having a coughing spell, or are you coughing?
It would, yeah. I would think it would be generic symptoms related to upper respiratory. it sort of would be that all-encompassing language that we've used for the one we've been dealing with the most would probably be the construction trades, because they've been actively working on essential projects during this whole shutdown. So they have a checklist. We could kind of base ours on what they've created, which has already sort of gotten the state DPH's seal of approval.
Good. That sounds very good.
Okay.
So that's your that's your
Jason and
interrupted.
Tiffany, we haven't asked. Okay, do we have a second on the motion?
Yes, I second it. Roger Christian.
Okay, let's open it up for discussion. Particularly if there are other people online, but I'd like to hear from Jason and Tiffany. Tiffany first, whether the two of you have some strong ideas on anything that we've discussed this afternoon.
My thought on the town meeting, I was initially thinking outdoors just because it's not a confined space, but I see all the trouble that it has to do with. But I agree with Jared, if we just have that checklist, made up of, another thing to add to it is, obviously we'll create this document, but another thing is, have you had recent contact? Are you a close contact of someone who's tested positive? They can't be allowed in the meeting as well. But I think if you go through that list, I mean, that's all you can really do. Other than that, I really don't have much of an opinion on it. I'm not really an expert about the town meetings. But health-wise, I think if you just go through a checklist, hope everyone's honest and go from there. Wear a mask and social distance.
Yeah. So the
Jason?
select board. Oh, sorry.
No, I agree with Jared's idea and Tiffany as well. As far as the indoor versus outdoor, I mean, you could really make it work either way. I think it'll slightly differ depending on what your guidelines are, but either way, I don't think you can go wrong. You'd be able to make it work. Other than that, nothing really else to add.
Is there anyone else on the line that would like to weigh in on this discussion?
You have 2 callers right now. I can unmute them and see if they have any comments.
Please, we would
Okay.
ask that they identify themselves and tell us what street they live on.
Sure. So the first one is labeled Margie. And Margie, you are unmuted. I'm not hearing anything.
Margie might have muted herself.
Hi, I'm just listening. I don't have any questions.
Okay.
I will mute and I will unmute the number ending 4172.
Hi, this is Christopher Coleman. I'm not a resident. I'm the town administrator here in Westwood. How are you? I just
Chris.
want, Chair, if I may.
Thanks for joining us.
How are you? Thank you.
Good,
Mr.
good.
Chair, if I may, I would just like to state for the board that the select board are scheduled to meet on Thursday as well as Tuesday. At both meetings, we have on the agenda discussion of the quorum, as well as the plan is to sign the warrant by the meeting on the 26th. So there are 2 meetings that the select board are currently scheduled to have.
Do you want to weigh in on the motion, Chris?
There was, I don't know who said it, but someone made a statement if someone was in contact with someone with COVID that they weren't allowed into town meeting. I don't know if we have the legal right to prevent someone from physically coming into town meeting the same way. I don't know if we have the right to physically, I presume we do not have the right to physically prevent someone from voting in person at a polling location. So I would suggest that if whatever Jared's going to produce, that he runs that by town council.
Yeah, definitely. I'm not sure on a lot of this stuff either, because it's a public event and not, a retail store or other private.
Well, it's a legislative event. It's not a public.
Right.
It's a legislative event. So.
Right.
All right, so there's a motion.
And I got on late. I'm sorry. I was on a webinar earlier, so I apologize. I got on late, so I didn't catch the beginning of your meeting.
It's okay. We have a motion, Chris, that's been seconded, where the Board of Health would vote to authorize Jared Orsini as the Public Health Director to establish protocols for the conduct of town meeting in regards to public safety. At my request as moderator. Any discussion on that, Chris?
Well, we've been looking to Jared for guidance on a number of things, and we will continue to do that. Jared has been influential in a number of discussions that we've had with different departments and how services and offerings can be made. And he has been part of our ongoing discussions regarding the safety operation of town meeting.
Okay. All right, so I'm going to take the roll call of the members. Carol Ahern, how do you vote on the motion?
I'm in favor.
And Roger Christian, how do you vote in favor? How do you vote on the motion?
Roger Christian votes in the affirmative for this motion.
And as the chair, I vote in favor as well. So the board has just authorized you, Jared, to establish some protocols for town meeting. If necessary, are the members available to meet again prior to town meeting if Jared feels he would like our guidance, or if circumstances change, are the other members available?
I am available. That's Roger Christian.
Okay, and Carol,
I'm also available.
Okay,
Carol
and I am as
Ahern.
well. Okay, thank you very much, everybody. Now we'll go on to our next item on the agenda, which I think is the report of the health director.
Okay, thank you. So we are holding firm fairly well, I think, in new COVID-19 cases. I think we're currently at 101 cases total since they've started testing. And we have seen a precipitous drop off this week. I believe we only had 5 cases this week, which is substantially lower than many weeks preceding this one. So we're going to take that as an optimistic sign that our community is heeding all of the precautions that, we and the state and the CDC and all of these different entities have put forward in terms of social distancing, hand washing, staying home when sick, limiting contact with, people outside of your immediate family with whom you're quarantining at home. So all of those things seem to be making a difference in our number. Hopefully the trend will continue. So we are still handling cases that are coming in when they do, and contact tracing and all of the appropriate precautions in terms of notifying close contacts. The governor obviously had spoken yesterday regarding the 4-phase reopening plan. Currently, some construction and manufacturing and some curbside retail is allowed to resume this week, with the target of next week for some loosening up of office spaces, car washes, pet grooming, and certain outdoor recreational activities, which I guess more needs to be said on that. The number, the phase I guess we're really looking forward to is the resumption of in-service restaurant meals and what that's going to look like. So I think we're preparing right now to work with our operators when the time comes for them to be able to resume dining inside of their establishments, what the restrictions and safety protocols will be. I think for the majority of our operators, they're going to have a challenge with the number of seats that they're going to be told they're going to be allowed to have. So we're going to try to work with them to be creative to see if there are some alternative outdoor seating areas that they can set aside. Obviously many departments will have to weigh in on that, but it's definitely in the conversation in other communities as well as here is how do we give these restaurants equal footing at least when things start to open up even further heading into the next phase, that they will be able to seat more diners and also seat people who may be uncomfortable going to a sit-down restaurant and sitting inside. And maybe that first step for some people would be like, you know what, I do want to go out. I want to have a nice dinner. I want to get out of the house, but I don't want to sit inside. I can sit outside. Great. So we'll have to put some protocols in place, for the sanitizing and the cleaning of the seats that are outside and, the seats that are inside as well. So we're anxiously looking forward to moving into that phase. And we're still waiting on firm guidance on summer camps and recreational waters, swimming pools and the North Beach and Summer Club at Hale we're waiting on guidance on if and when those can open and what their safety requirements will be. So hopefully that information is supposed to be released soon. Hopefully it's released sooner rather than later so that we have a chance to digest it and then to be able to advise the various stakeholders what's going to be expected of them. Other than that, we're still moving forward with building permit reviews and other various tasks that are routine for us, in our role. So, in many ways, we're just burning the candle at both ends, and the staff is, as usual, going above and beyond what they should be doing and what they need to do to make sure our services are maintained at the highest level.
Thank you. I have a question.
And
Sure.
if I neglected to say it,
This is Roger Christian. In terms of a restaurant that has been closed during this period of time, do they need any special inspection to reopen?
The early guidance indicates it's going to be a self certification. Most of our restaurants will be communicated with so that they're in touch with us. We have a pretty good idea of how many have ceased operations, during the shutdown, or the ones that have continued that were just doing takeout only. The initial guidance from DLS and DPH had indicated there will be a self-certification at the beginning. But obviously, it's subject to change as we move forward to closer to that phase.
Thank you.
all right. Public health, Tiffany? Public health nurse?
If everyone saw my report, for the month of April, we had 67 confirmed COVID cases. As of April 23rd, the CTC, which is the Massachusetts COVID-19 Community Tracing Collaborative, I know that was a mouthful, they partnered with DPH and they're assisting with contact tracing, which has been a huge help. I continue weekly webinars and DPH updates because the guidance literally changes every day. So we've been busy listening to that. And I just put a note on my report is the new antibody serology testing that's been being done. We now have to treat anyone who tests positive for that as a confirmed case because they don't know how to handle it in the sense that they're testing for IgG, which is an antibody that develops usually after an infection. However, they're saying there's some evidence that the IgG can start early on in an active infectious state. So now anyone who comes up positive and tests for that serum IgG test, we reach out to them. We tell them they have to isolate. And if they don't want to isolate, they have to get a PCR test, which is the nasal swab done to confirm to see if they have active infection. So I thought that was a little interesting because you hear that being pushed a lot. Go get the antibody test, go get the antibody test to see if you had exposure. However, if you do get it and it's positive, you'll be treated as you are a confirmed case, even though you may not be. So I just thought that was interesting to share. Other than that, pretty straightforward, just COVID. And any questions?
Tiffany, thanks. Question about other MAVEN reports. How about things such as hepatitis and all the other infectious diseases? Are those not being reported?
They are still being reported. However, I have not had anything for the month of April. I think just because people are not able to go to the doctors how we typically would, people are really encouraged to stay home. So unfortunately, I think a lot of things are getting missed because people aren't going to the doctors.
Okay, so there's no input to the MAVEN.
Nope, I
Okay.
have that was the only MAVEN related topic I had to add was
Right.
the confirmed COVID cases. Yeah.
Thank you.
Mhm.
I'm curious, how have people responded to your overtures in the contact tracing? Are people cooperative?
For the most part, yes. I would say from the beginning in March when we had our first case in doing the quarantines and everything, people were very, open about everything, forthcoming, answering our phone calls, super cooperative, very nice. Now I feel like just because everyone was nervous, we didn't know much, and now there's people we're calling, sending letters. And now some people have actually called to say, stop calling me, and they don't want to reveal any information. I do have a hard time getting contacts of people. They don't want to, most people have quarantined at home, have been home isolating in general, just because everything's been shut down and people working from home. So people aren't comfortable giving me, their family members' names, their friends' names and information. So that kind of gets hard. So I just give them all the information. I say, please pass this along. It's really important to stop the spread. We do the whole thing. We send out packets, and we just hope everyone does the best. For the most part, though, to answer your question, people have been cooperative and nice.
Okay. So you could, Carrie, give a percentage of the recent contacts. How many are cooperative? How many are not?
So I want to say, I would, percentage-wise for my contacts, I'm trying to think offhand because the last couple of weeks CTC has been handling that, so I don't have those numbers that they've given. For when I would say 50% of the cases that I handled, they would cooperate and give me names of immediate family members and such.
And 50% would not?
Yes.
Okay.
It's a rough estimate, but that's what I would say.
All right. I want to thank all of you for all you've been doing. I know it's an awful lot of work. You're doing a great job. On behalf of the Board of Health, we appreciate what all of you are doing. And I know the town does as well. Are there any additional items or topics that we need to discuss? Hearing none, is there a motion to adjourn?
I so move we adjourn.
In a second?
I second it, Carol.
All right, no objection. I declare this meeting adjourned. Thank you, everybody.
Thank you.
Bye, everyone.
you.
Thank you.
Thank you.